Birmingham is a very diverse city, so it's a 50-50 city. Traditionally, one of the youngest cities, but actually now we have an aging population. So when we start to look at population health and we start to look at the change of our demographics, for us, pressure ulcers started to be an area of clinical practice that we needed to focus on. We started looking at how we could reduce the numbers. So initially, we started to look at all patients. However, from a health inequalities point of view, I started to look at patients that had a darker skin tone. I started to look at trying to understand when they were having their pressure ulcers and if there was anything we could do to reduce the incidence. For us, it's been a learning journey. It's helped us to start to understand our population. I guess the other thing that's unique about Birmingham is that we have 80 commonly spoken languages. So for us, we needed technology that overcame a language barrier. And so again, I think it was quite important that that was also built into what we were looking for. So, so I'm sure as you see, it's not just addressing one area. When I started on this journey, I started to look at the imagery that we had in our organization. And for me, there was descriptors such as redness. And so as I looked at it, I thought, well, actually, my skin doesn't do that. And so that started, I guess, that journey of curiosity of saying, okay, if there isn't any imagery, how then do I know what I'm looking for? So now as an organization, if you have dark skin tone on our risk assessment, you're considered high risk. So there are additional questions that you ask to ensure that you're capturing at the first assessment that that individual is hopefully not getting, a misdiagnosis, because again, we know that it's not that when you're looking at chronic wound conditions, it's only at the later stage for people with darker skin tone that you see that. So actually, what steps are we taking earlier on to be more preventative in our care? And one of the areas we focused on was our district nursing teams. We started to look at how they provide care to our patients. And one of the things that we know is that as teams, I might go in today, my colleague goes in tomorrow. So how I assess the wound and report back might be different from how my colleague does that. So we started to ask the question, if the same person is not going in, what can we utilize to ensure that there's that consistency of care? And again, sometimes when we work in the community, we work as part of a multidisciplinary team. So sometimes we need to refer on or get second opinion. So working with our GPs and other practitioners, we were able to start to utilize this visual record to ask questions of specialists. So I think for me, one of the good things, so when you're in Isla, so if I went in today and took an image, you can actually have a line of images where you can start to see if there's any changes.
Isla helps patients like Emma, who had a nasty fall which led to a major leg operation. Emma has been spending a lot of time resting in bed as her mobility is still very poor. On the days when she visits, Emma's nurse uses Isla to quickly and securely capture an image of the wound. This saves immediately to the medical record, but is also available to the clinicians whose input is needed. This continuous flow of data builds a clear picture of Emma's health for the multidisciplinary teams. Teams such as tissue viability, Emma's GP, and her podiatrist. With Emma's progress visible at all times, the clinical teams can keep an eye on Emma and decide on the best treatment for her. 4 weeks on, Emma is recovering well, but her nurse still wants to monitor her condition. Through Isla, Emma can regularly upload the photos of her wound for clinical review. With Isla, Emma can get the right treatment faster and without having to travel to her GP or wait for another nursing visit. She also feels reassured, knowing that any changes in her health are being monitored.